Hello, everyone. This is Dr. Edwin Lee from Orlando, Florida, and I'm going to be speaking on update on epigenetics, understanding the biological clocks, and also talk about the future of medicine. And I'm really excited to be here. I want to thank Access Labs for sponsoring this, and I just want to tell you that I'm not getting paid to speak, but this is really an educational program. I've done this talk just maybe about a month ago or 6 weeks ago with A4M, and we had over 750 people sign up for this topic. So this is a very hot talk. And just as a disclosure, I have no financial relationship. I have no. I am a co-founder of Clinical Peptide Society, and if you guys are interested in getting certified in peptides, please contact me. And by the way, you can contact me, pretty simple, info@dredwinlee.com. And let me start off with the difference between genetics versus epigenetics. A lot of people get this confused. The idea of epigenetics, it's really what's our environment, how our environment's affecting the expression of our genes. And genetics is really our code of our entire body. So every cell has our 23 chromosomes, has our genetic material, and each part of our body codes a certain protein, and but we all have the same DNA material. So if you think of the words of a book is your genetics, epigenetics is really the stuff on top of your DNA. So if you think of epigenetics in this illustration, it's really like the sticky notes that's on top of your DNA. The words are not affected, your genes are not changed. Epigenetics is there's a lot of clutter on top of your DNA. And as we're born, we really have, if you can think of this way, this is just an analogy, is that when you're born, you really have no trash on your body, but as you get older, you accumulate more trash or more trash on top of your DNA. So you can see in this illustration, genetics, you know, on the left, it's all the words in the book is your DNA. And then epigenetics on the right is the words have not changed. There's a lot of, you can see sticky notes or trash that's accumulated. And this can affect your expression of your gene, which is really important. So epigenetics has a lot to do with gene expression. Now, just to review on the nucleic acids, because DNA requires 4 nucleic acids. These are not amino acids. You have your A for adenine, T for thymine, C for cytosine, G for guanine. And the methylation of the DNA really occurs only on the cytosine site. So you can see on this slide that you can methylate the 5 carbon here with the CH3, and it becomes from cytosine to 5-methylcystosine. Now, this concept of methylation and this issue is, well, I have a MTHFR defect. There are two different animals, and I even talked to my nurse practitioner last night. Is yes, you can have an issue with being you have a high homocysteine level. You don't basically metabolize it well because you have a MTHFR or defect or mutation. You're unable to convert THF to the methylated THF, or the methyl tetrahydrofolate, and what happens is you cannot contribute the methyl group so that you to break down homocysteine. But anyway, this has nothing to do with the methylation on your DNA. So they're two different, basically, they both require methylation, but they're two different, totally different areas of our body methylates. So there's methylation on your DNA, and that's on your nucleic acid called cytosine, and then basically there's the homocysteine metabolism, which has to do with your MTHFR gene. So now this slide here is really the key If you understand this, you understand a big concept of medicine, including cancer. So this is one of the key points here is to understand this. Now we have many genes and we have basically a promoter region of the gene. And there's this island called the CPG island. So that's really your nucleic acid, C for cytosine, P is a phosphate, and G is your guanine. And you can have it super methylated, so it turns black there. So there's methyl groups. So if you put a lot of methylation on your cytosine in front of your gene, what happens is your gene is repressed. So if this was like the P53 gene, you want this to be active. You do not want to shut the P53 gene, because the P53 gene codes for a certain protein to eliminate early tumor cells. So if you have any kind of early tumor cells in your body, you want to activate the P53 gene and you want to get rid of it. So that is really key. And if you cut off that P53 gene, this tumor will grow and it can even form cancer. That's one pathway. There's multiple pathways for cancer, but that is one main pathway you can consider. All diseases are really generally pathway derived. So whether it's you have chronic inflammation that leads to issues, it's really because of this methylation of the promoter region, and it's really epigenetics that affects it. So it's really our environment, our diet, our lifestyle, or stress that basically can affect the methylation on turning on or off your gene. So this whole science is called epigenetics. This pattern of methylation of the DNA can be measured, and it's really our interaction with our genes and environment that can affect our health. So we're going to be talking a lot about your biological age. How old are you? What is your chronological age? And this is something that we do in our office. Every new patient comes in here, we get a biological age and also look at the rate of aging. And I just saw a relatively young dentist. She had super amount of stress, and she wants to lose weight, like 40 pounds, and she just can't get her diet under control, and she feels her hormones out of balance, and she's the sole provider for her family. And so when she came back, just like 2 days ago, we go, look at your biological age. And surprisingly, it was much younger than her chronological age, which is good for her. And her rate of aging was much slower. So you can actually see how healthy you are. You can see how young you are or how old you are. So there is two different ages, your biological age and your chronological age. So we're going to be talking today in this webinar, and this is probably going to be pretty deep, but I want you to understand the basics, and I'm not going to go too deep, but it just kind of really highlight on cancer screening, because most people that die in your practice is either going to be heart disease or cancer. It could be something else, but those are the top two that are in the US. And I have a lot of people that are really interested in cancer screening, and this is they're using this technology, and I'll explain basically the company and what they do, but I just want you to understand the science behind it. And then there are 3 generations of epigenetic clocks. I kind of want you to understand what each generation does, and then how do you reduce biological aging. So this is a kind of a diagram of when we have healthy cells, we're normal, and then when you have eventually you have mutations and it can cause cancer. And there's a lot to do with epigenetic alteration. So loss of heterogeneity is loss of the gene that can cause cancer. So you can have, let's say, there's tumor suppressor genes and oncogenes involved here, but the thing is the epigenetic alteration can express the bad genes and turn off the good genes. And you can also have mutations in some of these things so that it turns on and turns off. So Epigenetics is really, it starts from the very beginning, and it can affect our cells where you have so much inflammation. Remember, all disease is really pathway of, it's really a pathway of, it's a disease of pathways. That's what the thing is. And if you want to really read a phenomenal book, is it's a really big book. It's called The Emperor of All Maladies, and it's a New York Times bestseller. And they talk about the history of cancer. And cancer therapy has been really barbaric, but it has really evolved into now the bioscience and understanding what genes are affected and what we can do and what we can target it. But before understanding the basic science, it was really just shocking what they did, because they really had no idea how to basically approach this disease. But the thing is, they keep talking about it's a disease of pathways. And when you have basically, you turn off the good genes and turn on the bad genes through epigenetics, you lead to basically you can lead to chronic inflammation that leads to basically dysplasia and then eventually cancer, and it's really tough to treat from there. But anyway, so I want to start off with this one case study, and because of this case study, it actually led to basically a discovery of, let's do a cancer screening test. So this is published in 2013, so less than 10 years ago. And she is 37 years old. She's a graduate from Cornell. She graduated summa cum laude. Then she got a PhD. She got married. She had a child. And then age 37, she just wanted to have a second child. So because of her age, she was considered high risk. And she had a prenatal screen test, was screened for like Down syndrome. And during her first trimester, her prenatal test was abnormal. So they did a workup, they looked at the baby, and everything was kind of normal, but they go, you got an abnormal prenatal test, let's repeat again, second and third trimester. And again, it was abnormal. But then when the baby came out, the baby was super healthy. Everyone's looking at the baby, but then the mom, she was bleeding afterwards, and she had a lot of pelvic pain. And it turns out she was, with her workup, she had stage 4 vaginal cancer that spread throughout her pelvis. And she had that positive prenatal test. And prenatal test is looking for abnormal chromosomes. And her cancer cells were secreting abnormal chromosomes. So she basically, this is kind of like, you think of prenatal tests, it's looking for the baby's issue, but there's that 0.1%, it could be from the mom. So they're thinking, wow, we could diagnose cancer through a blood test. And so it came out later, something called liquid biopsy, where you take the blood and you can check for circulating tumor cells. Unfortunately, that woman that passed away, she lived for 3 or 4 years, and then she passed away. But the baby was healthy. But because if she was around, this test was around like 10 years ago. If she had this test, it could have saved her life. But the thing is, that's the thing in medicine. It seems like every 5 to 7 years, this new technology comes out. So this test is looking at the plasma. So it's, you have your plasma, and they're actually technically looking at your epigenetics in your plasma. And they can detect DNA in your plasma, and they can see if there's this certain methylation or specific markers on this DNA that's circulating around, and see if you have cancer or not. So you have 2 different genes. One's called tumor suppressor gene, and one's called oncogene. So on the left, top left is your normal tumor suppressor gene, but if you hypermethylate on the promoter site prior to the gene, this methylation, then you actually turn off the tumor suppression like the p53 gene, and boom, cancer occur. Oncogenes, we normally have oncogenes. If you hypomethylate the promoter region, then what happens is you get cancer. So there's like the brake and the gas. So the thing is, it all depends. You're talking about hypomethylation, hypermethylation. But in this talk, we're going to be just talking about hypermethylation, just to keep the concept simple. So if you hypermethylate some promoter region, like the GSTP1 or the APC oncogene, basically you can develop either prostate cancer or colorectal cancer. There's many different genes that are involved with cancer. And there is a huge study that was multi-center, and it was done at the Mayo Clinic, at the Dana-Farber Center, Sloan Kettering, all the top cancer institutes around the world. Actually in the US, they had people documented with cancer, over 15,000 participants. And I have one patient that was at the Mayo Clinic. He comes to see me, and he actually did this test and so as a participant. But it's called the Ccga Study, Circulating Cell-Free Genome Atlas. And the age group varied from 21 to 89, so about 8,500 people with cancer, about 6,500 without cancer. And they basically validated that they can detect cancer. And they're very high in terms of specificity. It's like almost 99%, meaning that if you're negative, you're negative. But their sensitivity is, this is the downfall, slightly low. But as you increase this different stages, from stage 1 to stage 2 to stage 3, stage 4, the sensitivity increases. If you look at basically these two rapid growing cancers, pancreatic and ovarian cancer, you can see their sensitivity is much higher than 10 and 12%. So the faster growing cancer can actually be picked up much faster. If it's slow growing, like sometimes breast cancer, very slow growing, prostate cancer, very slow growing, you may not pick it up right away, and may not be clinically relevant too, to have, I mean, you always want to pick it up earlier, but it's maybe just kind of dormant and just sitting there. So here's our, a list of 50 different cancers that can be detected through one blood test. It's actually 2 tubes of blood, but one blood test, and you can see these different types of cancers. And 12 of the most dangerous, deadliest cancer, there is no screening test. And I'm not quite sure about you, but I've been to too many funerals, pancreatic cancer, ovarian cancer, you just name it. I've been to too many funerals in the past 10 years. And so, I mean, you can screen it earlier than 50 years old. It is really, that's kind of like, if there's a family history of cancer, yeah, you want to screen much earlier. This is not a diagnosis test. Basically, it's a screening test. And remember, the 12 most deadly cancers, there's no screening test for. One of my friends, he's an illustrator for the children's book. We've been working for years. Unfortunately, he's been diagnosed with esophageal cancer, stage 4. And I really wish he had this test a while ago, but this is a relatively new test too. And he's really battling pretty bad with esophageal cancer. So the thing is, like, how do you screen for ovarian cancer? How do you screen for esophageal cancer? How do you screen for, kidney cancer? I mean, there's a lot of cancers that just picked up accidentally, but here you can do something proactively. So this is not a confirmatory test. It's a screening test. It does not detect all cancers like glioblastomas or cancers of the brain, because the circulating cancer DNA does not go from the CSF into our plasma, so it doesn't cross the blood-brain barrier. So and it does not test for reoccurrence or minimal residual disease after surgery, but this company is actually working for it. But that is a great test, and you're going to be asking, what is the name of that company? And the company is called Galleri, Galleri. And the test, anyway, cost about $1,000, and it's currently not covered with insurance, but I have a lot of my patients who want to get that test done because they're concerned about cancer. So let's move on to how old you are, and there's something called epigenetic clock. I think that everyone should be getting this. If you have a wellness practice, we order this. Everyone gets this in my practice. We also do a lot of labs with Access Labs and do a whole hormone panel. And you can ask Access exactly what I order and all that, and you can look at everything that I do there. And so there is 3 different types of epigenetic clocks. And let me just kind of go back, just make sure I didn't miss anything here. So really, it's looking at your methylation of your DNA to give to predict your age, your biological age. There is close to 30 million sites where methylation can occur on your DNA that is related to aging. And you see on this slide here, the green, there's like lollipops, they're unmethylated, and the red one, basically, it's methylated. This the cysteine, the one of the nucleic acid has methyl group on it. So DNA methylation, when you see DNA M means methylation. They're just adding the methyl group to the cysteine. Anyway, so the epigenetic clock basically uses the presence or absence of these methylation. So there are 2 different types of DNA methylation clocks. We are not going to talk about forensic age. This, they've been using this for some time. So you see a dead body and they dig it up and they want to know how old this person is, or you have a person that's smuggled and you don't know how old this person is. So you can do basically, you use the DNA methylation clock. We are basically looking at the biological epigenetic clock, and we're going to focus on this: your biological age, your disease prediction, and your rate of aging. So the first generation epigenetic clock is designed to predict your biological age, and the person involved in developing a lot of these epigenetic clocks is Dr. Steve Horvath from UCLA. He did a wonderful study that will probably never be replicated. And he published this in 2013, and he used multiple tissues from all over parts of the body. Every part of the brain, the eye, or just every organ, basically, he sampled, looked at their genome and looked at the methylation, their epigenetics, and he had developed this algorithm. He's a mathematician, physicist, and he basically has a correlation of almost 0.96 with predicting age, but also develop your biological age. So he uses 353 certain methylation sites on your DNA, and there's 344 genes involved, multiple tissues. So when I read his paper, I'm thinking, how did he basically get samples from different parts of the brain? And it turns out that these organs were donated to him. So, I mean, it was like, how do you get it from the retina, and how do you get it from the brainstem? How do you get it from the cerebellum, the temporal cortex? I don't think anyone volunteered to get the brain sample, but these were people who passed away and they donated their brains and body to medical research. So he studied all nucleic cells, so not red blood cells, but anything that's nucleic, has a nucleus, tissues and organs, and he measured 27,000 plus different sites spanning over close to 15,000 genes, and he came down to really about 353 sites that basically can give your biological age. So he, by the way, there is a big difference between biological age and chronological age, because you've seen this. Like, you see someone that that is, quote, 40, but technically is like 70. They've had already a heart attack. They've had their survivor this and that. They have there's multiple system failure, and they just look like crap. And then you have some people who are like 65 that look like they're 40. So you can't really go with your chronological age. You really should go with epigenetic age. So they evolved this first generation clock to predict biological age. And there's 2 major clocks I want you to part of the first generation clock to understand. Dr. Steve Horvath basically looked at about 350 CPG sites, and he really talked about intrinsic age and Hannen basically, it's a different researcher published about the same time, also gives basically your biological age. Now, there was a debate between Dr. Horvath and Dr. Hannum in terms of should you control for the immune system, should you not control for the immune system? Because remember, this is not plasma, this is serum. So in your serum, you have a lot of your white blood cells, and you have your like neutrophils and lymphocytes and B cells and everything like that. So if you have autoimmune condition, your immune system goes crazy, you have allergies, your eosinophils go up. And so it will affect, they're looking at particular types of your white blood cells and looking at their DNA and looking at the methylation there. So your immune system in certain diseases can be thrown off. So Dr. Horvath believes that you should control for the immune system, and Dr. Hannum goes, screw that. It's just basically there should be no control. So you'll get intrinsic age versus extrinsic age. When you report biological age, people are talking about the intrinsic age. It's controlled for the immune system. Intrinsic does not mean that it's within yourself. Extrinsic, it's outside the variables. A lot of people, like I've listened to at different meetings, they don't understand this intrinsic versus extrinsic aging. It really has to do with your immune system controlled or not. So the first generation epigenetic clocks have to do with predicting biological age. Second generation epigenetics clock has to do with predicting mortality or disease prediction. And so they used to have this, to make this algorithm work better, they collected a lot of data, but now they don't even need any of the data. They don't even need to know your sex, your age, if you smoke, if you drink. They can actually tell you if you drink or if you're a heavy drinker or you can smoke. They can tell a lot by looking at the pattern of your DNA. It's like a certain fingerprint. So there are two different clocks. One's called Levine, the pheno age, and then Dr. Lewin Horvath has an interesting age clock called Grim age, kind of like that name, Grim age. And you can see that there's more CPG sites, and it can actually predict predict disease. So this has been validated. Multiple studies predicts cancer, predicts all-cause mortality, predicts time to death. So it has been validated. All these clocks have been validated extensively, and they used this machine from Illumina to basically look at gene sequencing, and they're looking at certain CPG sites, and you can see the higher, the like first generation, second, third generation, they look at more and more CPG sites. Most people are using the Illumina 450K when they look at the CPG sites. The latest can detect up to 850,000 CPG sites. So the data is pretty overwhelming. So I think I went a little too fast here. So here we go. Here's a review of different epigenetics clock. Remember, Horvath did the pan tissue clock. Hannum also looked at your biological age, and then you have the pheno age and Grim age here that looks at predicting diseases and mortality. So which clock is better in predicting health? They did a study. They looked at the four major clocks, Horvath, Hannum, pheno age, and Grim age, and they had this study that looked at different things, and they had about 500 people participate. And the bottom line is Grim age was the best in terms of outcome. So that's the second generation clock. So the third generation clock is really fascinating, and this is basically the Dunedin poem study. And Dunedin is actually a small little town in South Island of New Zealand. And I was fortunate to be at Christchurch. I gave a lecture once in Melbourne, Australia. We stopped in New Zealand, and we did the North Island, South Island. And if you're an outdoors person, you love nature, you love to hike, you'll never want to come back. It's literally heaven out there, the New Zealand. And it's pristine. And no one actually ever speeds there. It's only the Americans visiting because they're probably late to going to the Hobbit show or something like that. So anyway, this third generation clock, Dunedin Poem, it's actually looking at the rate or pace of aging. And the study actually started not as a rate of aging study. It actually started in 1972, and they wanted to look at the kids all born there, and they wanted to see how healthy. So it was more of a pediatric study, and they had over 1,000 kids enrolled, and they looked at it every year, and they basically had the whole town to participate. Doctors gave volunteer free time, nurses also. So the whole community contributed. The kids would be pulled out of school. They asked the employers to pay, the dad and mom to come to spend all day with the child to basically do this extensive study. And they did true assessment, and then eventually evolved. And the thing is that this has been going on for 50 years. And they actually looked at blood work at age 26, 32, 38, and also now 45. And so this Professor Belsky from California basically looked at all the data, and they've been following these people, and they can go back and forth in time to see how many people had heart disease, how many people had strokes, how many people have these conditions, and they could go back in time to see what their methylation pattern on their DNA is. So they go back and forth, and they're actually basically developed this algorithm to see the rate of aging. And this is something that you want to know. Because number two is, how old are you? What is your biological age? And are you aging super fast, or are you aging slow, which you want to, or are you aging normal? So this algorithm has been validated with 3 other long-term studies. And the people who age faster develop chronic disease or die earlier. And those that are aging slower basically have better performance on balance, strength, walking speed, mental ability, and also look younger. So they did an interesting study in a randomized caloric restriction. It was a 2-year study. And the people who had they worked with a dietitian and lost about 15% of their 15% of the initial weight. And the people basically did caloric restriction, slowed the rate of aging. So just changing on how much you eat, and you can reduce your caloric restriction, you actually turn on a gene called the SIRT1 gene. It's a 2-in-1 gene that help fix and damage any damaged DNA. So caloric restriction has always been around. And so there's many methylation clocks out there. There's blood versus saliva versus multiple tissues. You got to be careful online, because there's some people that say, hey, I did this, I took this, my biological age got younger. But if you look at what company they looked, they're not using validated first generation clocks, or using Dr. Horvath or Hannum's algorithm to calculate their biological age. So you have to ask how many CPG sites are used, what algorithm are they using. And most people are doing basically blood. There are companies that are doing saliva, but the blood has been really super validated. So you got to be careful on what you do. I use, since it's non-CME, I use a company called True Diagnostic, and they basically charge about $350 to do this study. And I have all my patients do it. So now, can you reverse biological aging? And I'm going to open up to questions. So if you want to ask any questions, you can go to the Q&A sites there. And unfortunately, it's interesting. So if you're interested in asking questions, you can ask there. So we're almost done here, but we have 3 generation clocks, and there was a study with the caloric restriction. And what's interesting is that they had weekly counseling for 24 weeks, and they had the first month, they had 3 meals provided, and they had also a dietitian, and you had to lose about 15% of your body weight to basically to do this correctly. So that's a big weight loss, 15%. And then another study that came out, this is Dr. Horvath again, it was published in 2019. It was basically published in Aging Cell, and Dr. Horvath and Dr. Fay from UCLA and other colleagues was there. So they actually used human growth hormone 3 times a week, DHEA and metformin, because they felt growth hormone can cause diabetes or insulin, they can cause glucose intolerance, so they want to use metformin, and DHEA can also help there too. But they used these 3 agents, and what's interesting is their thymus gland regrew. So they did MRIs before and after, and you can see that the thymus gland was, that when they were older, these were all men, that their thymus gland that was filled with fat basically was filled with normal tissue, and their immune system actually improved. So they looked at before and after. But what's interesting is their epigenetic age actually significantly decreased by the results of 4 different epigenetic clocks. And regression of the epigenetic age after 6 months of discontinuation of therapy. So it lasted for some time, and they're doing part 2 of the study, and hopefully they'll have women in that study. So we're almost done here. So we have this upcoming study that I'm enrolled with, and I had 21 people in our study, and we use senolytic therapy. We use 50 milligrams of dasatinib and 500 milligrams of quercetin 3 days in a row per month for 6 months. So imagine like January 1st, 2nd, 3rd, you took this combination, then February 1st, 2nd, 3rd, another combination, and March 1st, 2nd, 3rd. So for 6 months they took this. We did blood tests, a lot of blood tests before, mid, and after. And the bottom line is that everyone got younger in the study. And if you look at the different types of it's based on 6 months, you can see that the biological age basically improved. And the thing is that for me, everyone stopped aging. Everyone got younger. So if you looked at your biological age, I dropped by almost 4 years in 6 months. So some people, FYI, dropped about a year. Some people dropped 2 years. Some people just did not age at all. So what's really interesting. So 6 months, you saw the biggest thing. So I'm not participating. I'm starting another part of the study, and we're going to tweak it and do something different. So anyway, hopefully this study will be published. So review of the epigenetic clocks. I know this is pretty deep here, but we're almost done here. And if there's no question, that's fine. I know that it's late here, but so there are 3 generations of epigenetic clock. First one's really simple. It basically looks at your biological age. The 2 big hitters are Dr. Horvath, Dr. Hannum, and they're looking at multiple CPG sites to give your biological age. And 2nd generation predicts disease and also mortality. 3rd generation is your rate of aging. So you get all this through basically a true diagnostic. And the thing is that you can also screen for cancer. You can actually look at many different things, which I'm not going to get into. But if you if you do functional medicine, you reduce stress, you basically exercise, you stop smoking, you eat healthier, you can also reduce the rate of aging. So, as I imagine most people listening to this are doing functional medicine, it's really, you got to have a healthy lifestyle, and you should measure your epigenetic age. So I'm going to open to questions. I appreciate everyone listening, and let's see, if we have no questions, then I'll just end it right there. But I'll give you a minute. If you want to type any questions, please feel free. If you're interested in doing the true diagnostic test, you can contact True Diagnostic. You can contact Hannah, and Hannah Went, W-E-N-T, and her number is 937-570-0471. So let's see. So again, it's Hannah Went from True Diagnostic, and it's 937-570-0471, or you can look up True Diagnostic and TRU Diagnostic, and just inquire there. So anyway, I want to thank Access. I know I didn't really talk about anything with Access, but Access is phenomenal. I've been working with them for close to 15 years. and super great. We had to get a stat lab, and they really helped me to get a chemistry done quickly so my patient could get an MRI. They needed to know his kidney function, and so just kudos to them. And I love their initial panel that I do, looking at multiple things, including CD4, CD8 ratio, the immune panel, all the hormones, and inflammatory markers, and looking at looking at G6PD, and looking at a complete thyroid panel with reverse T3, free T3, and thyroid antibodies. So I've been using this panel. You can ask them what I see, what I do, and you can actually use that panel if you want. Also, do follow-up for men and females. You can look at what I do there, but I just, generally check the chemistry, CBC, and their vitamin D, CRP, ferritin, and also look at all their hormones, and for both men and women. And you can look at what I do there too. So I want to thank Access again for providing this opportunity for me to talk. And I want to thank everyone listening, and thank you. So I'm just gonna end it right here. So thank you. Have a great day. Bye.
Dr. Lee.
All right.
All
Hey.
right.
All right.
Appreciate it.